Good afternoon, colleagues. My name is Pascal Alote, Director, UNU-IIGH, and a very warm welcome back to Working Local, Thinking Global, a joint initiative between the United Nations University International Institute for Global Health and the United Nations Resident Coordinator's Office. You may recall that the first in the 2022 series was led by Karima El Khoury, the resident coordinator, with Richard Marshall, the senior economist. They outlined the role of the UN in Malaysia and the coordination role for all of the UN agencies, and spoke of some of the specific ways in which the office supports the Malaysian government and people in Malaysia, using examples on the pandemic recovery. Following on from that, we hosted Åsa Torkelsen, who outlined the activities of the UNFPA, the United Nations Population Fund, which works on population and development, sexual and reproductive health, and gender. UNFPA, just as a reminder, by the way, has since launched the State of the World's Population 2022, which makes for a fascinating read, outlining our progress globally, but also some regression that reflects the areas that we all need to work hard on towards the achievement of the Sustainable Development Goals, but also because it is just the right thing to do. And the UN stands ready to provide the support where appropriate. Today's webinar is from the World Health Organization, the agency that has been in everyone's home over the last 2.5 years, thanks to the COVID pandemic. Before we get started, some very quick housekeeping notes. Please introduce yourself through the chat. Let us know where you're joining us from, and please put any questions you have in the Q&A box. Don't wait until the end. Just drop your thoughts and queries as you have them, and we will do our best to engage with you. Let us know what you do or don't like, and most importantly, we sincerely hope you enjoy the webinar and leave better informed. It is now my absolute pleasure to introduce a brilliant health colleague, Dr. Rabi Abiasinghe, the WHO representative and head of the WHO country office to Malaysia, Brunei Darussalam, and Singapore, based in Kuala Lumpur, Malaysia. Dr. Rabi arrived in Malaysia in January 2022 from his previous position as WHO representative and health of the WHO country office in the Philippines. But he's no stranger to Malaysia. Since 2011, he has been based at the WHO regional office in Manila, with several lead roles in health security and emergencies, coordinating malaria and other vector-borne and parasitic diseases, and supporting the regional response to COVID-19. A warm welcome again to Malaysia, Rabi. Thank you for the continued support through the persistent threat of COVID-19. Dr. Rabi, the virtual microphone is yours.
Thank you, Pascal, and very good afternoon, colleagues. Thank you for this opportunity to Pascal and the UNU. I think this is a wonderful opportunity, and it's an excellent series of Working Local, Thinking Global. see how we are making progress towards the SDG and sharing that knowledge with colleagues who are joining us today virtually. As before I start, I want to say that COVID-19 pandemic has been a wake-up call for many of us, and it has significantly changed the way we think and do things, and it continues to evolve. We are still not out of the pandemic, and so we will continue to draw lessons from how we respond to the pandemic and see how we can better serve our member states and advance the agenda to achieving the SDGs. Having said that, I'm going to talk today about health in the Sustainable Development Goals. The SDGs comprise 17 goals, and the health goal is listed as goal number 3, which is good health and well-being, and that is ensuring healthy lives and promoting well-being for all at all ages. It's important to catch the emphasis that it is about ensuring healthy lives. It's about promoting well-being, and it's applicable for all peoples at all ages, irrespective of whether they live in developed countries, whether they live in mega cities, or whether they live in villages, whether they live as indigenous communities. Whatever the objective of the Sustainable Development Goals is to ensure that all of them, whether young or old, whether newborn, are able to live life to its fullest and have a healthy life. Next, please, Anne. So, as I mentioned, the health aspects of the SDGs are not merely captured in goal number 3. Factually, if you look at it, nearly all of the 17 SDGs are in some way contributing to health. And so this was the vision we had, that health is determined by socioeconomic and environmental determinants. And for clarification, you would wonder why before. And the before is, this is the way we viewed the SDGs. When the SDGs were conceptualized, we believed that each SDG individually will contribute to the achievement of good health. And that's how we went into the COVID-19 pandemic. Now, I'm going to digress a little from the SDGs and talk COVID-19, because I want the audience to accept the magnitude of what COVID-19 has done. And next one, please. And so if you look at the pandemic and its implications, as of the 10th of April this year, that is 28 months now and continuing, we are still in the pandemic. We have a reported number of 496 million cases reported to WHO and 6.17 million deaths reported to WHO. I'm saying reported to WHO because we certainly believe that the numbers will be higher, but this is what has been officially reported to WHO on a global scale. And next one, please. And then let's drill down into what's happening here in Malaysia. And then if you look at the data as of the 18th of April, Malaysia had reported 4.396 million cases and 35,400 deaths. So it's quite clear that COVID-19 has had a major impact on the health of people globally, but also here locally. Now, if we look at the impact of COVID-19, and could we move to the next one? The COVID-19 pandemic has not only impacted on people's health through the number of cases and the number of deaths, it has also contributed to a disruption of routine health services. I believe that many of you can relate to the fact that you or your immediate family has been challenged either because of movement restrictions, because of a lack of access to healthcare facilities due to crowding, or some other reason where routine healthcare services could not be accessed during these past 28 months as a result of the COVID-19. Many people on regular maintenance treatments, many kids who need to get their vaccinations have not been able to do that because the routine healthcare systems have been disrupted. And that's because not only of the movement restrictions, but also because our healthcare workforce has been extremely stressed and pushed to the limits in caring for people. Can we go back one? And can we go back one? Yeah, okay, sorry. And so the other issues that have been impacted by COVID-19 is the fact that the COVID-19 and the lockdowns, the numbers of close family members affected, the loss of close family members has resulted in a serious and what we call a silent pandemic of mental health and mental stress and challenges to many people. And this has also been exacerbated by the fact that many people have lost opportunities for employment, especially those persons who were self-employed or who were in so-called day wage earning jobs. They've lost their avenues of employment. This has contributed to increasing the mental stress levels and caused challenges to them. And in addition to that, even the younger age groups have been challenged because many of you know that many schools were closed for extended periods. Children had to either learn to do online education or had to were actually dropping out of education, large numbers. So all of this has contributed to what we call the silent pandemic of mental health. And of course, the economic disruptions that COVID-19 has caused. Many countries have been affected, including here in Malaysia. We've seen the predictions for economic development have had to be scaled back. Oftentimes, they've gone into negative growth rates. And so that economic disruption has been also unprecedented if you look at many countries and what it has happened. So we are now, even though we are not completely out of the COVID-19 pandemic, we are in urgent need of having a sustained, accelerated program for economic recovery and also for the recovery of our health programs so that we ensure that we continue to protect the lives of people as we continue to wage a battle against the evolving COVID-19 variants and the disease. So this is where are we now. And next slide. So because of that, WHO, together with the Regional Committee of Health, that's the Regional Committee of Ministers from the Western Pacific region, which includes Malaysia, Singapore, Brunei, and all of the other countries of the Western Pacific adopted what we call the For the Future strategy, which has 4 key areas, and that is health security and antimicrobial resistance, non-communicable disease and healthy aging, addressing climate change, environment and health, and reaching the unreached. These were the 4 priority areas that were identified by the ministers of health in the region as a plan of action to advance the SDG agenda in the region over the next 5 years. And it was in this backdrop that COVID-19 happened. And for many reasons, we found that at that time, the Western Pacific region was better prepared to respond to COVID-19, largely due to the efforts of the WHO and member states in strengthening health emergency preparedness, aligned to the Asia Pacific strategy for emerging health diseases and conditions, also the APSED. So these priorities are the areas that we will continue to engage with the member states and support them as we work locally towards preparing them and helping them advance towards achieving the Sustainable Development Goals. Next slide, please. So I said early on in one of my earlier slides that all of the 17 Sustainable Development Goals we thought would help to contribute to improving health. But post-COVID and during COVID, we realized that health is important for all of the other 17 SDGs. Because without good health, all progress relating to all of the other SDGs are really affected and at risk. So COVID-19 was actually a wake-up call on the importance and the need for countries to invest and ensure that we have strong health systems, we have strong healthcare systems capacities, we are prepared to respond to emergencies, be they emergencies that are caused by pathogens or be they emergencies that will happen as a result of climate change and environmental catastrophes like the recent flooding we saw in Malaysia. So it is now clear that health is probably very, very important if we are to ensure that we have progress across all of the other SDGs as we move towards the 2030 goal. Now, we don't have a lot of time. If I remember, we have about 2,700 days remaining towards 2070. And if we move to the next slide, we come to realize that there is a huge risk that all the development we plan or we achieve could be at risk if we ignore and do not invest adequately in improving health and healthcare. Now, I'm saying this not because I'm from the WHO, but this is what the last 28 months have shown us. And I don't think anybody has any doubt about that right now. And what is important is for us to make sure that we use this new knowledge to ensure that all countries, including Malaysia, invest significantly in continuing to deal with the COVID-19 pandemic, but also importantly, to deal with the emerging post-COVID situations. The way WHO sees it, we classify this as ensuring that everybody has access to universal healthcare. Can we have the next slide, Christine? So, because universal healthcare will become everybody's business, and if we can ensure that whoever at whatever age has access to good health, has access to quality health care, is not overburdened by financial strain because of the need to access healthcare services. In this way, we can ensure that universal healthcare is actually universally available in all countries to all populations, and that countries are then better prepared to ensure that the health-related SDGs and indeed all of the other SDGs are not placed at significant risk. So next slide. As I mentioned, next one. Universal healthcare means that all individuals and communities can receive essential quality health services they need without suffering financial hardships. I'd like to reiterate that when we talk universal healthcare, we talk of ensuring that there is a system to ensure primary health care at the grassroots level, and then secondary and tertiary health care for as health systems in countries are set up. Next slide. So it was way back in 2019 that the 72nd World Health Assembly had a vision for primary health care for the 21st century. Next slide. Where we articulated that primary health care is a whole of society approach. It is comprehensive and integrated, and it addresses the determinants of health, including social, economic, and environmental factors. And most importantly, it empowers individuals, families, and communities. So this was from 2019, before COVID-19 happened. And if we now look at how we define universal health care, next slide, we said we want all individuals and communities to receive essential quality health services they need without suffering financial health hardships. So here there's two elements. One is the quality of health services, and the quality of health services will include both what services, that is the coverage, and where. So under this, we are talking not of medical services. I want to reiterate that we are talking of the full spectrum of health services, and increasingly we are realizing that we need to pay more attention to the promotive, preventive aspects of health than trying the medical or the curative, rehabilitative, and palliative approaches across the life course. So it's important for us to view health from a holistic perspective and address this in that way, so that in the UHC approach, we ensure adequate attention is provided for those promotive and preventative aspects as we continue to develop our curative, rehabilitative, and palliative services. And then the second important element is the no financial hardship or the social protection coverage. So it means that there needs to be a series of measures against socio-economic distress caused because of economic income loss and the cost of necessary treatment due to ill health. And multiple socio-economic studies have proven over the years that the promotive preventative aspects are more cost effective, more economically viable and profitable. And so that is why we are stressing that, yes, we need a focus on the promotive preventive aspects, but also it's critically important that we ensure that there is minimum financial hardship and socio-economic distress to people affected by certain conditions, particularly those conditions that require more costly interventions. I'm talking of the management of cancers, the management of some non-communicable diseases, infections like multi-drug resistant TB, etc. So whatever the condition, we need to ensure these two key elements are addressed in the universal healthcare approach. So what is becoming clear is that our concepts of health need to change. Next slide, Christine. The classical way we approach health was we looked at being healthy as an individual responsibility, and if you're diseased, if you're sick for whatever reason, that becomes the business of health insurance, or if you have national coverage, that becomes the business of the national healthcare system to provide the necessary services. Now, this approach is clearly flawed, and we've come to understand that this dichotomous approach to health is no longer a viable and profitable way that we can continue to provide services to people. And so we are now talking of a new approach, next slide, where we view the health as a continuous series from health to poor health, and in that there are individual responsibilities. There is the need for investing in health to reduce the risk, and of course once you are sick there is the health insurance aspect. But importantly, we are also beginning to realize that there are individual determinants that determine the health of an individual, and that could be genetics, that could be lifestyle factors, and there are of course socio-economic and environmental determinants, and that is also why in the regional priorities we are addressing climate change, healthy environment, all of that. And then when you are already diseased, you have poor health, then we come across the socio-economic and environmental barriers of healthcare that we need to address during efforts towards progressing towards the SDGs. And that's about ensuring access to good quality health services, ensuring the quality of health services, and the fact that these services need to be free or of cost that does not affect individuals. So this is where we are. As I mentioned, for Malaysia, as we think locally, as we work locally and we think globally, we commend Malaysia for its progress towards the UHC goals. And this has been reflected by its strong response to COVID-19. But also what is important is that Malaysia has also understood that there are areas that need improvement in its health systems. And so the government is now working on healthcare reform package that hopefully will get presented to the Parliament later this year. And within that, increasingly it is beginning to be clear that health is not something that can be done and conducted just by the Ministry of Health, but that it requires a multi-sectoral approach, very much like the SDGs, so that we can address in a holistic manner the socio-economic, environmental determinants and barriers to health, and not view health as purely a problem that needs medical solutions, but rather take a proactive, promotive, preventative approach so that we in future manage to reduce the health events that would require intervention and management, and help to improve the quality of life of people and thereby keep them more active and contributing on the longer term for economic prosperity of their communities, both here in Malaysia and globally. So this is where we are now as the COVID-19 situation is improving, as Malaysia has opened its international borders, as the country is working towards bringing back its economic development on track and progressing towards catching up on the lost momentum. It is important that we continue to address the challenge of COVID-19 and also focus on the recovery of routine health services and engage in the necessary changes in the system to strengthen capacities and to ensure that we can achieve the goals set out in the 12th Malaysia program, and of course the framework for SDGs that Malaysia has signed on to. I'll stop here, and I'm happy to take any questions if you have. Thank you.
Fantastic. Thank you so much, Dr. Ravi. And I had a whole list of my questions before we even get the audience questions, and you have actually addressed most of the issues. Now, however, though, you had particularly, and I was really, really excited to see the last lot of slides, that it is, I think, health has more than any other time, because of the COVID pandemic, actually been given a lot of airtime. But ministries of health still struggle with what is within their mandate. And as you mentioned, because largely it is based on, our ministries of health are based on disease rather than on health. So to my mind, it seems like we have two major challenges. One is in the configuration of the notion of ministries of health and what is health. And the other is the challenge of putting health or foregrounding health a little bit more in other sectors. Because again, as you mentioned, that it's very much that health has to be everywhere. Can you think of really practical strategies of examples where this has worked? I mean, given we're thinking global and acting local, do you have any concrete examples about what that might look like, and how we can work towards seriously a model where health is everywhere?
Brilliant question, Pascal. The evidence is standing and right in front of our eyes, because if we had posed this question when we were formulating the SDGs and the response to SDGs, many people would have said, well, you can say this, but health is a matter for health and everybody else has their own business. But if you turn back now and look at how countries have responded to COVID, 19, it has not been a response by the health ministry alone. It has been a whole of government approach. It has shown where countries came together across the spectrum of the society. Those countries have had a more successful control of COVID-19. And Malaysia is a point in case. We have seen how the government and the private sector and even beyond, even people have joined hands in this response. And the lesson here is that this should not be limited to responding to COVID-19 and the pandemic, right? There is here a proven case of a system that has come together, has delivered, and we need to build on that. And this is the opportunity. I mean, if you're asking, where is the evidence? Can you bring this to happen? Can you make this happen? Yes, it is. Here we have evidence in front of us that when countries or within countries, communities come together, you can do things much better than working in separate individual silos. So I think we are at that stage now where we need to use this evidence that we have in front of us to use the connections that health and other ministries and other departments have developed to continue to stay engaged and move this agenda. And I'm talking just not health, I'm talking about the wider SDG agenda also. Because even for the wider SDG agenda, this has been an opportunity to sort of loosen those silos and create connections. We find in countries, ministries that don't usually talk to each other are now talking to each other, are working together. And this is a wonderful opportunity to build on that momentum and move not only the health SDG agenda, but the whole SDG agenda. As I say, this is what the SDG agenda is about. It's about a holistic approach.
So I have what I believe is a follow-on question for that. That it is, and we actually see this. The UN is guilty of it as well. That it's very easy to make nice motherhood statements about this, and for countries to sign on and agree to it. What accountability mechanisms are there? Or how do you think countries in general can be held accountable, but also each sector in an intersectoral collaboration? How do we ensure that they remain accountable to ensuring population health?
Well, you're right in saying that we as the UN also have been sort of siloed in our approach. And the SDGs have been that platform that have helped many UN agencies to come together to work towards common goals. And the accountability aspect is, of course, the responsibility within the country towards its population and how the government captures that and remains accountable to its electorate and its population towards achieving not just the health-related SDGs, but all of the SDGs and progress as a whole. So, I mean, as the UN and even this series of webinars that we are doing is also a reflection that we are trying to come together, we are trying to bring about that holistic approach of working together rather than working siloed. And within the UN also we have now an SDG fund. We are looking at multi-stakeholder programs so that we can work and add momentum to the work that we were doing individually by working more closely in a holistic manner. And the message is that if you're smart, you would learn from the experience of the last few months and continue that and not just limit it to health.
And again, sort of continuing on that thread, You had noted, again in your presentation, kind of the challenges that over the last couple of years, at least, where the pandemic effort detracted a little bit from other health priorities. And so diseases like cancer and so on may have had to take a backseat to the pandemic effort, and it shows the cracks in health systems if we're not able to respond to all of this. And I know that globally as well, there's lots of discussions about pandemic preparedness, pandemic treaties, and so on. If you had to imagine a world in 3 years' time, do you think we are ready now for the next pandemic, and that we would be better prepared? Are we back on track, or are we in the direction of moving back on track towards other global priorities? And if not, what do you think we need to be doing to prepare for it?
So 2 questions there. One is, are we better prepared for a future pandemic? Clearly, yes, some of the things that have forced us to come together, the ACT Accelerator, all of those initiatives have shown that how rapidly we were able to develop vaccines, how rapidly we were able to develop diagnostics and treatments that are now being utilized for COVID-19. So I think looking back, the world now is in a better position to respond to a future pandemic. The world understands the risk posed by pandemics and why we need to continue to prepare and improve our preparedness and response capacities to deal with that. What has probably impacted us more is not how we respond to the pandemic, but I think COVID-19 has also shown us that there is a critical need for us to ensure continuity of other services. There is a critical need to minimize the wider social and economic impact of pandemics. And for that, I think we still have a long way to go. And that's why we are talking of recovery of health services, recovery of economic development, challenge, progress, etc. Because I think there's still some lessons that we need to draw out, and we need to prepare for a future pandemic where we will not make the same mistakes, where we will not have to face the similar economic downturn, the similar economic challenges that people had to undergo, the mental stress that they had to undergo. So if we are better prepared, if we have learned our lessons, and if we can bring them to realize them in the next few years, I think we will be much stronger as a community, both in country and globally.
Right. Fantastic. So a question from Christina. Moving beyond the COVID pandemic, do you vision the primary healthcare differs in providing UHC, and how could it be sustained to strengthen the development of healthcare?
So
the vision of
yeah, I mean, moving beyond COVID-19 pandemic, certainly we envisage that primary healthcare is critically important because, as I highlighted already, if we are going to focus our efforts on the promotive and preventative aspects, the key, the bulk of the work will need to be done at primary healthcare level. If we ignore the primary healthcare aspects and focus on the secondary and tertiary healthcare, that becomes a more curative, palliative response. And time and experience has shown that those communities, countries, societies that invest in the primary care approach are better prepared to deal with situations, have healthier populations. And it's important to recognize this also in the Malaysian context, because Malaysia right now is at a critical time. Our predictions are that by 2030, you will have more than 15% of your population above 60 years. That would mean that Malaysian society could be considered an aged society. And that would require that you plan for that now. And that is why we have started this discussion with the Ministry of Health, the Ministry of Community and Women's Empowerment also, on how we can plan for that and prepare the society for eventually continuing to maintain economic momentum, even though you have a large proportion of people who may be contributing less to the economy. We don't want that to be classified as a burden to the economy. That's why we are saying we are encouraging healthy aging and looking at how even our aged populations, our elderly populations can contribute to societal well-being and the development and continuing enhancement of societies and the quality of life rather than becoming a burden to the society. And if we plan proactively for that, and there are global examples of countries that have done that, I think we will be much better prepared for that in the future. And in all of that, primary healthcare is critically important as we work towards universal healthcare.
Great. We have another audience question. The future, regarding the For the Future strategy, is there any particular initiatives that focus on tackling mental health in particular?
Well, we do recognize the importance of mental health and mental well-being. And again, it's not, the global evidence shows that many of the risk factors that contribute in later life to mental health situations or mental disease happen throughout the life course. And that's why we are now increasingly talking about mental well-being throughout the life course. And we don't view mental health or mental disease as something that is stigmatized. It's a life condition that needs to be managed through the life course. And through that approach, many mental health conditions can be better addressed and we can continue to improve the engagement of people affected by those conditions and continue to ensure that they participate in society and contribute to economic well-being and development. So this is something that we are increasingly aware about. And I must say that we are now in the process of developing a regional mental health program plan on how we can address this challenge in this part of the world, but overall in the SDGs also this is recognized and we are working towards that.
Great. Another question from the audience. Digitization has been greatly promoted to advance universal health coverage and the SDGs. What are the challenges identified by WHO in bridging the digital divide of healthcare to achieve universal health coverage in countries within this region?
Well, there's two issues here that we need. Actually, there's even more than two issues. Digitalization is critically important, and we have seen the important role of digital initiatives and how they can contribute to improving health and monitoring of health events at individual level through during the COVID-19 pandemic. And we would like to see those virtual digital health efforts continue beyond the COVID-19 pandemic because It's also an important way of addressing and minimizing our carbon footprint by reducing the need for people to be traveling to hospitals or healthcare institutions, where it can be that digital monitoring, digital service provision can be continued. But also importantly, digitalization is important to monitor progress, because we say that if we want to make progress, we need to measure how we are progressing. So the digital platforms give us a wonderful opportunity to access information in geographically diverse, dispersed areas quickly, centralize the data, and to draw conclusions on where we need to prioritize our efforts if we want to minimize disparities. So it is important that we recognize the power of digitalization and maximize it by incorporating it into health and health-related programs. At the same time, there is, of course, the challenge of digitalization. We need to ensure that individual privacies and data are secure and are not cannot be hacked by other people. And also importantly, we need to ensure that we have stable connectivity and access to digital platforms. This may not be the case in Malaysia, but in many other countries of this part of the world, that is also a huge challenge. So, as I said, there are many angles that we are looking at, and again, it reiterates that this is not just a health issue, but a much broader societal issue that we need to address.
Yeah. Dr. Rabi, quite a few of the people we have online are from Malaysian universities, are health researchers and experts and so on, that have conducted lots and lots of research in various aspects of health and are very keen to engage with WHO and with the country's efforts in doing this work. What's the mechanism through which the country office will engage or can engage with the Malaysian public that want to engage with you?
Well, we are continuing to support our efforts and channel them through the government channels because, as you know, WHO functions as the secretariat to the Ministry of Health, and we help and assist the Ministry of Health and related government agencies. But at the same time, we also look towards academia and other civil society organizations and how we can work together to advance the health agenda. So we are very open to working with academic institutions, civil society organizations who have similar interests to us in improving the health of people. And it depends on which areas you are interested and whether that sort of coincides with the areas of work that we are working and supporting at this point of time. If you want to know more about the work we do have our own website. We will be coming out on social media and Facebook very soon. And oftentimes we also look for assistance from local partners. We look for partners to contract and to deliver various activities or programs, and many of that is advertised either on the UNGM website or we on our website. We seek applications, and we would encourage anybody interested in working and partnering with WHO to continue to look to those sources to see where we are. But of course, you can also reach out to me or my staff so that we can understand where your priorities are, what are your interests, so that we are better informed. Thank you.
Great. Just before this question just in, and I can't ignore it, what is the biggest challenge for women? And what is the most important thing for solving the problem recently in the various regions and countries that you have worked in, specifically within the context of COVID-19?
Well, I wouldn't say there is a biggest challenge. There are many challenges that face women and men. But if we look at women, a lot of them have had multiple challenges. From the health perspective, we have seen that in many communities, accessing COVID-19 vaccines have been lower among female populations. So that's something that we need to address and ensure that females are as well protected as males, or to a similar percentage. We would like to see universal coverage of all eligible people with vaccines. We are also conscious of the fact that extended school lockdowns, working from home, has created multiple challenges for women, even if they are not engaged in occupations, even if they are managing small children, when they're managing small children, when they have to manage homes. So all of these have created many, many challenges that we are aware of in every society. I'm not just talking Malaysia. There's global evidence to show all of these challenges, and Malaysia is no exception to that. So we are conscious of that. We are conscious of even increases in gender-based violence in some societies. So all of this we do recognize as areas important, and we stand committed to supporting those efforts. Again, I want to stress that a lot of this is not just WHO alone. We have other UN agencies that work in these areas. And of course, we have government agencies that lead the work and we support them behind. So we do recognize that there have been multiple challenges for women, and which of them is the largest, it depends on where you are and what are the challenges you're facing.
Great. Dr. Rabi, thank you so much for your time. You've given us a very nice overview of WHO's work in general, WHO's work and prioritization in Malaysia in particular, some insights into the priorities for now and into the future, and the priorities for the region. It's also really nice to know that having had spent this hour with you, people on the call and whoever gets to watch this afterwards, because it will be available on YouTube, will know how to contact you if they have further questions. So Dr. Rabi, thank you very much and welcome again to Malaysia. We hope you really enjoyed the time that you're on posting here, and that we have lots of opportunities to collaborate with you. I'd like to say a very big thank you to my colleagues who work behind the scenes to make these webinars possible. Nadia, Adnan, our very quietly capable and brilliant program officer, and Cortez and Radhika Das, who are responsible for the communications and technology. Thank you very much, you're brilliant. Now, our next webinar is being given by Jody Mitra, who is with the International Labour Organization, and that will happen on the 19th of May. Again, even if if labor is not necessarily your area of expertise and you joined us today specifically for health, you're more than welcome to come again. Please tell your colleagues who are interested in those areas. I think it is a very important aspect of the UN's work and of everybody's life. We all need to work to put food on our tables. So we look forward to seeing you on 19th of May, and thank you so much for joining us today. Have a lovely afternoon. And please feed in, answer the feedback survey and let us know how to do this better. Thank you.